The nursing profession has taken center stage today as the world commemorates International Nurses Day. The day is commemorated on the birthday of Florence Nightingale, who is the founder of modern-day nursing. This year's theme, Our Nurses, Our Future. Various celebrations are set to take place in Cape Town, including visiting the Provincial Health Minister's visit to the Western Cape College of Nursing to pay homage to future nurses. Right, so for more on this, we're going to be joined via Zoom by Health Systems Trust CEO, Dr. Themba Moeti. A very good afternoon to you, Dr. Themba. Thank you for your time here on the SABC.
Good afternoon to you too, and thank you for this opportunity, and greetings to the viewers.
Perhaps we could talk to the significance of International Nurses Day, how key their role is in the country's healthcare system and healthcare systems around the world.
Thank you. Yes, the significance of International Nurses Day is really to show appreciation for all the work that nurses do the world over in supporting health systems and patient care and the like. And in fact, as you're asking, nurses play a critical role in any health system, and particularly in developing country health systems like ours. They are absolutely the backbone of the health service, particularly where primary health care is very important, and they are the biggest number of professionals by far in the health system. So they really are called the backbone of the health system, and that's no exaggeration. And anyone who's worked in healthcare, interacted with health systems, almost certainly one of the people you'll be dealing with, and generally most often you'll be dealing with, are nurses. Yeah.
Dr. Moeti, I was reading some stats from the SA National Nursing Council, and it appeared to suggest that there's one nurse to every 218 patients, and this was just of last year's stats, where it should be one nurse, in fact, is also juggling about 6 jobs at this point. And I wonder how you'd weigh in on the shortage of nurses, which seems to be, quite an alarming high rate at this point, given the exodus, given the skill shortage as well. Is this a potential global health threat as we speak?
Well, yes. I mean, as I mentioned, nurses really are critical to any health system. And in 2022, it was estimated that globally, there's a shortage of about 9 million nurses the world over. And it's in developing countries like ours where those shortages are greatest. There was an estimate done that probably you would need to reach about 75% of the universal health coverage goals or targets on the African continent. You'd need at least 60 nurses per 10,000 people. Currently, most countries are at less than 20. And as you mentioned, this is a profession in which a lot of people are moving out of, as sometimes with other health professions. There's a lot of emigration abroad because this is a critically needed and scarce skill. And so in our setting, we are often the ones with the greatest need, but the ones who are actually providing nurses to developed countries. And so it's not an exaggeration to say a lot needs to be done to make sure that this critical profession is given the support, strength it needs, and can attract and retain nurses. Otherwise, health services will be in dire straits, and there is already a critical shortage of nurses the world over, and our country is no exception.
Let's talk to some of those solutions on the table, just on the back of what you've echoed. What are some of those tangible steps to improve the profession, considering, the nurses are the backbone at the forefront of delivering universal healthcare coverage and obviously assisting the world at large to achieve health sustainability?
Well, I think amongst the things that have to be done is to make sure that in the end, as a profession, it is attractive. If you recall, maybe 30, 40 years ago, it was a highly valued area in which to be working. So one of the things that has to be done is that nurses should be valued in the way that's appropriate, and amongst the things to do is make sure that they are paid the kind of salaries and get the kind of income that can attract them to the profession and retain them. That's one. Secondly, it's important that playing such a critical role in the health system, they also are given the appropriate responsibilities, the leadership roles and others, so that in the end, their influence and impact on what happens in the system, the decision-making, development of policies, including things like conditions of service, then can come to the fore. So unless those things are done, then progressively, nursing, like some other health professions, will then be struggling to attract and retain, people. The COVID pandemic, with all the dangers that nurses and other healthcare professionals faced, and they were at the forefront of this, many of these highly skilled, very dedicated professionals were lost due to this pandemic. And some, of course, was that early on, it wasn't known exactly what to do, but later, things like challenges in providing adequate protection against infection. So what has to happen is one, it needs to be, we need to make sure it's a safe space in terms of protection against communicable diseases, illness, and others. Secondly, we have to make sure there's the appropriate safety and security for the staff. And then thirdly, we have to make sure that it's an area in which it's fulfilling. And when they work in such a stressful environment, they are provided with the appropriate support, care, whether it is counseling, ability to, get the right levels of rest from a very stressful job, and really also to feel valued. So, these are the things that are critical, but also it's important that there are the right development opportunities given to them, like any other profession, in terms of career growth and the like. But most importantly, there must be a policy environment that is supportive and creates an environment in which this then does become a very valuable area in which to work. And when you create that kind of environment, healthcare workers, which they've done, over generations, will know that there are risks that come with it, but they are dedicated, but they must be given the right types of support in the policy environment and work environment.
Dr. Moeti, let's leave the conversation there. Thank you for your time here on the SABC. Dr. Themba Moeti, he's the Health Systems Trust CEO, weighing in as the world commemorates International Nurses Day.